Welcome back. You know, your health matters to Fox 10 News. With October being Breast Cancer Awareness Month, we want to make sure you know what to look out for when it comes to detecting a problem.
Fox 10's Chelsea Sayasan sat down with a local doctor to talk about self-exams.
As you know, October is Breast Cancer Awareness Month, and Southern Cancer Center wants to make sure you are informed. Today, we're focusing on the importance of self-breast exams. Dr. Connie Uzel joins us today on Fox 10. Thank you for being here.
I'm glad to be here.
Yes, and we were just talking. I want to ask you first and jump right in. How do I accurately perform a breast self-exam? You were just telling me you don't want this to take the place of imaging, though.
Correct, absolutely. But it is very important to be aware of your breast and your anatomy, and to check yourself in the shower or perhaps lying down. Some sort of systematic way that you kind of work your way through the breast tissue, know how it feels, know what's normal for you, and be able to detect something that's not normal, something that's new, something that doesn't feel right.
So what visual signs and physical signs should I or someone else be looking for?
Well, the traditional signs of breast cancer would be a lump, something that's very well demarcated, something that has true edges, it's very firm. It can be along the kind of same lines as maybe an almond or something like that, a little bit firm and has discrete edges. It's usually not tender, so it's something that you would feel, but not necessarily, it wouldn't hurt. Also, if there would be skin changes, dimpling over that, that would be not a good sign. If there's some sort of change in the nipple, a little bit of deviation or distortion, or a change that in the skin or nipple would not be good either. So look at yourself in the mirror.
At what age should folks start doing this, and also how often should you do these self-exams?
Yes, we would recommend a young age, and that way you become very familiar as to what would be normal and what would not be normal. We also would suggest some sort of periodic schedule, maybe once a month, but something that you can remember, and make it important. It's important to take good care of yourself and be healthy, and checking and breast awareness is a big part of that.
If there is a concerning lump or symptom, what's the first thing someone at home should do?
Yes, well, it would need to be, you would need to seek medical attention. Usually that would be from your doctor. Many times that might be a gynecologist or even your primary doctor, but ultimately it would need to have some imaging done, which would be a mammogram or an ultrasound. These two studies are remarkably good at detecting breast cancer and discerning what would be breast cancer and what would be a cyst. Or what would be something worrisome, or what would be something benign. These two studies are not perfect, but they're remarkably good.
For more information about you, Dr. Uzel, or about Southern Cancer Center, where can folks find that online?
Yes, we have, Southern Cancer has a website. We also have a Facebook page. We have 5 clinics across both Mobile and Baldwin counties, and we are happy to see patients. We're happy to see people with these same questions that we're talking about.
Well, thank you so much, and we'll have more information on fox10tv.com.